As you would have noticed, the number of cases in Guyana has been increasing. And one of the reasons for that is that we're doing a lot more testing, a lot more samples are being taken off. And as a result, we seem unable to meet that demand. So I've been specifically asked as a laboratorian for more than 20 years to look at our systems that we have there and see if there are avenues that we can improve and increase our capacity for testing. Our constraint specifically has been staffing and the amount of competent people that we have to conduct the tests. So over the last week, there's been a lot of planning in making additional teams available for testing. And in so doing, we have asked persons from other non-essential areas to come into the laboratory to provide that support. And we have also conducted we started to conduct a training to facilitate that sort of improved competency among the staff. Based on what we're seeing is in the fields, there's a lot more samples being taken. So for example, on an average, we'll get between 200 to 300 samples on a daily basis. But our laboratory's capacity currently is only able to test maybe a maximum of 140. So there's always that backlog of samples waiting to be tested. So with this training that we're having for the staff, it is hoped that maybe within the next week to 2 weeks, we can improve on that, increase our capacity to 300 samples, right? But that means we'll have to extend the hours of services that we have, and we'll have to build the number of teams that we have working. So the aim ultimately is to work 24 hours, and that will be facilitated through training over the next 2 weeks to improve the number of persons that we have capable of doing the test.